So I call this the Health Olympics, the ranking of countries by life expectancy using data from the Central Intelligence Agency with 2010 estimates and limiting it to just the United Nations countries. Here we are among just those limited countries at 29th, and we're 4 years behind the longest-lived country, Japan. Now, we could do the calculations for 2001 with and without the horrible tragedy of September 11th. How much difference would those 3,000 lives make in the calculations for that year? No reason you would know, but it would make 100th of a year difference. You would see nothing. Yet we invaded 2 countries because of that event. So 4 years is huge. If we eradicated our leading killer, cardiovascular disease, the condition that will kill roughly half of us in this room if trends continue, we would gain about 3 years of life expectancy and still not be the healthiest country. Like I said, 60 years ago, we could rank in the top. I'm sure we were in the top 5. We don't have good data for all countries, but now we're behind all these other countries. Why? Well, we immediately would think it must be healthcare. But we already spent half the world's healthcare bill, and I'll later point out there are no studies demonstrating the impact of healthcare on the health of whole populations. They do not exist. Then it must be our behaviors. Out of all the countries on this list, which country has the smallest proportion of men smoking? Turns out to be the United States. 23% of American men smoke. Which country has the highest proportion of men smoking? Everybody agrees. 53% of Japanese men smoke. Is that the reason we're the healthiest country in the world? If I wanted you to believe that, then you'd be wise to not listen to anything else I said. But it does suggest that there are factors that affect the health of whole populations that are more important than personal behaviors such as smoking. So that's an important thing to understand, namely that personal behaviors, all the studies demonstrate, amount to about 10% of our health as adults. What about the other 90%? Well, I'll get to that. Meanwhile, I said this is one of the best kept secrets in the country, but there are plenty of publications presenting comparative mortality data between the United States and other countries. One is this publication by the United States Congress in 1993 called International Health Statistics, What the Numbers Mean for the United States. If you go to a very interesting table, figure 5.2, what you see is if you're 25 years of age, what are your chances of making it to age 65 for men and women in the United States, here, lowest probability, and a number of other rich countries. So our Congress knows this. Our chances, if we're 25, reaching age 65, for men or women, are less than in all these other rich countries. It's the best kept secret. Our chances of retiring are really very small in this country if the standard is comparing ourselves to other countries. And this is a federal document. What if you're age 65? What are your chances? How many more years do you have left? So this is life expectancy for women, how many years they have left at age 65 from 1960 to 2000. Notice U.S. women were the second longest lived of these group of 6 countries, Australia, Japan, Canada, France, United States, and United Kingdom. But by 2000, they were the second shortest lived of those 6 countries. 2005, we are at the bottom. American women are at the bottom. Data not on this chart. In June, the National Academy of Sciences released a report on international differences in mortality at older ages. And it was embargoed until 11 o'clock Eastern Standard Time on June 30th. How many of you heard about this report and its results? John, because I sent it to him. So what do they show? Well, they looked at how many years do we have left at age 50. Remember, life expectancy is life expectancy at birth. At age 50, we're about the same as we are at birth. The other interesting thing is to what Kristen called the maternal wall. This is the maternal wall. It is just so much harder if you're a woman in terms of your health, because your health is not improving and you have much more to grapple with than men do. So in that report that was embargoed until June 30th was this interesting graph of how many years do women have left at age 50 in the United States and other countries, looking at trends from 1955 to 2008. And you can see back in 1955, U.S. women had more years of life left at age 50 than in all these other countries, but something happened around 1980, and health in U.S. women stopped improving as much as it had been, and it raced ahead in the other countries. Okay. Many graphs all showing roughly the same thing. Our women are dragging us down. The same thing isn't happening for men. It's really U.S. women that are not seeing the gains in health that other countries are. Maternal mortality, Kristen talked about this. We rank 39th in maternal mortality, deaths of women in childhood, and the rate is actually going up from 1990. Infant mortality, no better. But here again, I'm always looking for where does the U.S. government publish data, and so this is Health United States 2009, and in 1960 we ranked 12th, in 2006 we ranked 28th. All the other data is similarly not so good for length of life. About a third of U.S. medical students think the United States is the longest lived country and has the lowest infant mortality. So you already know more than your doctor. So we have a serious problem in this country. And the studies, the bulk of the studies show that it is the income gap that is the most significant factor that is correlated with this. And I won't go into those data here, other than to suggest, again, our federal bodies, the Institute of Medicine, points out in the future of the public health in the 21st century that more egalitarian societies have better average health. So again, the government knows this stuff, most people don't. I want to get on, rather than talking about what it is about inequality that matters, to show you one more kind of unfortunate map. This is a map of U.S. counties, and life expectancy changes from 1983 to 1999. So if women's health on average is not improving very much, in this study, in 20% of U.S. counties, life expectancy for women is actually declining. More recent data, not yet published, shows that that's up to 30% of U.S. counties as of 2006. So women's health is, in absolute terms, going down in 30% of U.S. counties. Not a good idea. I mentioned personal behaviors don't matter much. About half of our health as adults is programmed between the erection and before we go to school. And I don't know, this is called the developmental origins hypothesis. I don't know if you saw this cover of Time magazine, October 4th issue. It's all about the first 9 months being a critical period for our health as adults. Societies that are healthier, that are longer lived, have policies in place for a variety of things to support early life. And I strongly urge you to read that article or the book by Amy Paul, or any number of other books. This is the new idea that early life lasts a lifetime. And so if we're going to be healthy, we have to create conditions in early life that makes health happen. So let's forget about healthcare for now. I want to go on and suggest that we live in the United States of amnesia, as our previous speaker suggested. Namely, when we were much healthier as a country, we had different policy perspectives. So a Democratic president in 1942 proposed a maximum wage, 100% tax on all incomes above $25,000. That didn't pass, only a 94% tax passed. In 1969, Nixon proposed a guaranteed income for all American families with children. So 50, 60 years ago, we were all about more equality and everybody sharing in the wealth. But if you look at, these days, what operates is a massive redistribution to the rich. That's because the rich had seen their wealth share decline, and John DeGraff pointed out to me this quote from Business Week in 1974, it will be a hard pill for many Americans to swallow, the idea of doing with less so big business can have more. Nothing in modern economic history compares in difficulty with the sell job that must now be done to make people accept a new reality. We we all have less, so that guess who has more? All the beneficiaries of our bailouts. So they have been really doing very, very well, while the rest of us have been dying younger, doing less well economically, and even the rich die younger. There is no cherry-picked population in the United States that is as healthy as entire countries. So what are we going to do? Well, I suggest that what we need are policies that support early life, and I would suggest paid prenatal leave as a possible policy. We are the only rich country that doesn't have paid prenatal leave. Already we've heard about maternity leave. Only 4 countries don't have paid maternity leave. Those are the kind of policies that I think we want to do. Well, how are we going to get there? Well, how do people unlearn something and learn something new? Washington knows this very well. In Washington, the search for truth is a creative process. First, you create a premise. Next, you create a statistic to back it up. Then you create an audience by repeating it over and over until the media pick it up. And then you know you've done it. Done what? Created a fact. We have to make people aware of the fact that we die younger for living in the richest and most powerful country in world history. Strategy of Preventive Medicine, a very important book by Jeffrey Rose, concludes with the following, with the paragraph: the primary determinants of disease are mainly economic and social, and therefore the remedies must also be economic and social. Medicine and politics cannot and should not be kept apart. And I'll leave you with that.